Have you started noticing hair thinning, hair loss, or just concerns about losing your hair? By the time you notice hair loss, at least 50% of your hair has already gone. If you're looking how to prevent or regrow some of it back, keep watching this video. Hi everyone and welcome. This is Dr. Valentine. In this video, we're going to talk about the most common causes of hair loss and what over-the-counter treatments are available for you. We will also talk about the prescribed medicines or treatments by your doctor that has been scientifically proven to show results. This way you can stop spending time second-guessing yourself and start the treatments right away. We are in August and it's National Hair Loss Awareness Month. Hair loss can have a profound psychological impact, leading to feelings of embarrassment, diminished self-esteem, anxiety, and depression. So let's dive deep into hair loss. When we talk about hair loss, we usually divide them into two types: non-scarring hair loss, which is potentially reversible, and scarring hair loss, which is permanent. Thankfully for us, the most common cause of hair loss is non-scarring hair loss, accounting for 70 to 75% of the cases. And the leading cause of hair loss is androgenetic alopecia. So how do we diagnose hair loss? Most hair loss causes can be diagnosed based on history and physical alone. For example, androgenetic alopecia in men present with hair loss at the vertex, which is the back of the scalp, and in the frontal area. In women, it's mostly a thinning of the scalp in the central area. On the other hand, alopecia areata can present with patches of hair loss throughout your scalp. And on telogen effluvium, it can present with a drastic falling of hair of the entire scalp. So let's go over the hair growth cycle of your hair follicle. So the hair growth cycle is split into phases: the anagen phase, which is the active growth phase, the catagen phase, which is a regression in between phase, and the telogen phase, which is the resting phase. Once we're in telogen, once the hair follicle is in telogen, it can then go back to the anagen growth cycle or to the exogen phase, which is when you shed your hair. This is very important when discussing the different types of hair losses, and we'll get to them in a little bit. So most of our hair follicles are in that active growth phase, the anagen phase. Around 90% of them are in this phase, and around 8% of the hair follicles are in the telogen or resting phase. So let's talk about androgenetic alopecia. In this hair loss, dihydrotestosterone or DHT plays a central role. And going back to the phases of the hair growth, this shortens the anagen phase, which is the active growth phase. It reduces hair follicle space. It decreases oxygen supply and nutrient supply that the hair needs for growth. The end result is that the terminal scalp hairs, the long, thick, pigmented hairs, are turned into vellus hairs, which are characterized by being short, thin, and lacking pigment. Another hair loss cause called telogen effluvium, a non-scarring hair loss cause as well. We see an abrupt conversion of the hairs or the hair follicles from that active growth phase, the anagen phase, to the resting phase, causing significant hair loss throughout your whole scalp. Of most importance is that in this hair loss, there's a preceding inciting event 3 months before. So when your doctor sees you and is discussing what could be causing your hair loss, he will ask if you've had any changes in the last 3 months. For example, common triggers preceding your hair loss could be pregnancy, postpartum, malnutrition, endocrine disorders like low thyroid. If you suffer from anemia, it can also cause stress, decrease oxygen to your hair follicles, and might stun them and switch them from the growth phase to that resting phase. And those hair follicles that are in the resting phase that can go back to the growth phase because of deficiencies will shed. Other potential causes for telogen effluvium are infections and stress. So let's dive into treatment and what we have over the counter available to us to help prevent or slow the hair loss and regrow some of it back. So over the counter, we have vitamins or supplements that can help with hair regrowth, and we have a topical solution called minoxidil readily available for us to buy over the counter. So Nutrafol can provide key ingredients for hair growth like saw palmetto, iodine, ashwagandha, vitamin A and C, and biotin. And the potential benefits of all of these ingredients is that saw palmetto in some studies has shown to lower dihydrotestosterone or DHT, that hormone that plays that central role on androgenetic alopecia. The iodine will help support the thyroid, which can also cause telogen effluvium, like we've discussed previously. It has ashwagandha, which can provide stress relief, which is another cause of telogen effluvium that can affect it. And vitamin A and C can decrease that oxidative stress to the hair scalp. And biotin will help with it's the building block for hair production and keratin. Minoxidil over the counter can be found in two concentrations, the 2.5 and the 5. Go ahead and get the 5 for both men and women. It's FDA approved for treating hair loss for both men and women. So we recommend getting the 5%. Minoxidil works by prolonging that growth phase or the anagen phase of the hair growth cycle and by shortening the telogen phase. This is very important. As we discussed earlier, the telogen phase is that resting phase, okay? So when you start taking minoxidil, you might experience some initial hair loss. And don't panic, because what's happening is that those hairs that were already programmed for shedding will shed because the telogen phase or that resting phase is shortened. But this is a good sign because that means that minoxidil is working and it's doing what it's supposed to do. So let's talk about the prescribed alternatives that we have that your doctor can recommend for you. So we talked about topical minoxidil. We have oral minoxidil. Minoxidil was usually used to treat high blood pressure. And in the studies, they found out that patients who were on minoxidil started growing more hair in all places. So they tried minoxidil orally first, but since minoxidil is a blood pressure medicine, it can lead to side effects like lightheadedness, dizziness, lowering your blood pressure. So they decided to test a topical solution, and that's how minoxidil topically became the FDA-approved treatment for hair loss. Another prescribed option is finasteride. Finasteride, what it does, it blocks 5-alpha reductase, which is a enzyme that converts testosterone to the most active testosterone form, dihydrotestosterone or DHT. In studies, this medicine has shown that it halts hair loss in at least 90% of men and stimulates regrowth in at least 65% of men. And like it says, this medicine is only FDA approved for men. And finasteride has its own side effects. It can decrease your libido. It can play and increase ED. So if this happens, we also have a topical solution alternative if you develop any of these side effects. We have another option that is prescribed as well, but these are off-label, and the medicine is called spironolactone. Spironolactone, basically what it does, it decreases the total amount of androgens and thereby decreasing DHT or dihydrotestosterone. This is used in most commonly in women to help with this. Again, spironolactone is a diuretic, and it can cause lightheadedness, dizziness, low blood pressure, and it can also increase your potassium levels. So if your doctor prescribes this, just know that he might have you come into the clinic if they perform blood draws there, or send you to the lab to keep an eye on your potassium levels. So let's talk about procedure treatments that can help with hair loss. The first one is PRP. PRP is platelet-rich plasma. It involves drawing blood and spinning it down. And when we spin it down, the red blood cells fall to the bottom. And on the top, we have that plasma that is rich in platelets. And it's a specific area that we draw that plasma from. And we inject it in your scalp, and this platelet-rich plasma has a lot of growth factors that helps stimulate your hair follicle to produce more hair. Another option that we have is microneedling. There are some studies that have shown that microneedling at least once a week in combination with minoxidil to prove to be superior to minoxidil alone. And lastly, we have hair transplant. Thank you for watching this video. If you have any questions regarding a topic and you would like for us to make a video on it, leave it in the comment section below.